And tonight with a sobering reminder that the coronavirus pandemic isn't the only health crisis people in southern New England are battling. I'm Mike Ponte-Calvo.
And I'm Shannon Heggie. The Rhode Island Department of Health says there have been 233 drug overdoses between January and July of this year. During that time period last year, the state saw 185.
The increase is alarming to state leaders, and similar trends are also appearing in other parts of the country. 12 News reporter Sheena Lasciuto spoke to the medical director at the Department of Health and breaks down what they believe is causing the tragic uptick.
When talking about these fatal overdoses, Dr. Nicole Alexander Scott wanted to make one thing clear. There's help for you if you're struggling. She says she wants every door open for treatment, support, and recovery.
Sadly, the drug overdose crisis is worse now than it has ever been.
Dr. Nicole Alexander Scott shedding light on yet another alarming trend here in the Ocean State. In July, the state saw more fatal overdoses than ever before. And as of now, the state's on track to have 25% more overdose deaths than in 2016. That's when Rhode Island hit its previous peak.
The stressors and isolation of the COVID-19 pandemic have certainly contributed to these numbers. But we also started seeing increases in the first 3 months of the year before COVID-19 significantly changed the way that we live.
The crisis is not new. Medical Director Dr. James McDonald explains there are several contributions. One is certainly timing.
We've had the overdose epidemic going on in Rhode Island for years. And when you basically have two epidemics colliding, that's called a syndemic. And basically it's these linked health problems that act synergistically to make each other worse.
He explains while the world changed, the drug supply wasn't interrupted. Dr. McDonald says people are also buying counterfeit pills on the streets and end up with something they didn't mean to have.
I know from my law enforcement colleagues that 1 out of 6 of those pills has a lethal dose of fentanyl in it. So that's disturbing, and that's what's driven a lot of what's happening in our deaths. It's just too many substances out there.
And for more places to find help, you can head to our website, WPRI.com. Dr. Nicole Alexander Scott also mentioned that fire stations in Providence, Newport, and Woonsocket are safe stations, meaning if you go there, you can talk to someone and find your first step toward recovery. I'm Sheena Lasciuto, 12 News.